I'm Charles Keller. Today we're discussing your cataract condition. Here's a plastic diagram of your eye. Here's the front, here's the back. Years ago, your vision, you'd be excellent with no cataract. But now, in your exam, and because you have some blurred vision, the yellowing of the lens impacts your vision. This is the cataract. This is sort of the front part of the eye. The cataract impacts your vision. Presumably, you're familiar with trouble seeing street signs, trouble reading your computer. You might notice some glare or halo, or particularly some trouble night driving. This is the issue relates to your current cataract. I perform the surgery personally. The surgery is performed in a surgery center, and the recovery is fast. In the surgery, I go on the side, we go in, we break up the cataract, and then we implant an intraocular lens into the eye. The lens we implant sits in the same location where the original cataract was. The lens we implant restores your vision. The lens we implant gives you that excellent vision. Turns out we have several options, and we'll discuss options in the next video.